Hello, everybody. Welcome to another episode of this Cannabis in 2025 in our podcast, uh, Chat and Calm. So, I would like to invite our host, Scott. And last time, like we did two episodes of this, and he explained from introduction level and then the benefits last time. And these are online for you all to see. And today, Scott, we are going to focus on treatment for cancer also today, right?
Yes,
Okay, so
let's
I'll
do
hand
it.
it over to Scott to teach us about these things and educate us about the uh, usage of cannabis for uh, even treatment of cancer.
Okay.
Thank you so much,
Hey,
Scott.
thank you very much for the intro, Sanji. Lovely as usual. And thanks for all who choose to drop in and check this out and listen to it down the line a little bit. My name is Scott. This is Chatter and Calm, episode about 8, I believe.
Mhm.
And as Sanji said, we've been focusing on cannabis the last couple episodes, dialing now into cannabis as a potential possible treatment for cancer. I guess there are a lot of different ways to kind of attack that one, or let's say discuss it. Attack it gives the wrong feeling, but there is, you know, I worked in the capacity in cannabis in the capacity of medicinal cannabis for 2 years in New Mexico, and um, after working with I call them patients because it was a registered medical cannabis facility in New Mexico, and we had to abide by uh, very strict privacy laws, and so I don't hesitate to call it a medicinal experience. And then working with cancer patients and for all types of cancer. Um, the first thing, I think it's probably a good idea to start this talk, and I might be repeating some of the things we mentioned in the past,
Mhm.
but there are a lot of different ways to consume cannabis, and traditionally people just smoke it, either in a joint, which is like a cigarette, or in a pipe. They smoke the what's called the flower, which is the bud of the cannabis plant. When it's after it's dried, you can crumble it, and again, you can either make small cigarettes. It's called a pre-roll or a joint, or you can put it in a pipe and smoke it. And they also have water pipes, which are nice in that they cool down the smoke a little bit, so it's not so harsh
Oh.
as you breathe it in. Um, that's historically been the most common way of using cannabis. But in contemporary now, modern times, what they do is they make an extract from cannabis, and with that extract, they'll make numerous different types of products that are very good in the medicinal context, but also I'd say very good for cancer. One of the things that is they do with the extracts is they'll combine it with a little bit of oil because the extract by itself is very, very strong,
Mhm.
and so they'll combine it with about 50% oil, like a consumable oil, like avocado oil or coconut oil, or even hemp oil is a very, very good thing to combine with cannabis oil because the hemp and cannabis are effectively the same plant.
Mhm.
Um, and then with that combination of oil and cannabis extract, they'll make pills, which they call capsules, and you can just consume those, just like medicine or vitamins or supplements that people take that are very, very popular. That's a very effective way of using cannabis for cancer. Another way that people also will consume it is by making something called edibles. And typically edibles are on the sweet side of things. I've seen some people try and create a savory edible. Those never seem to be that popular. But the types of edibles you see most, the most popular one right now, I'd say, is a gummy, which is just like a fruity flavored gelatin. Uh, are you familiar with gummies in Sri Lanka,
Yeah,
Sanjay?
yeah, we have, but
Yeah,
not the exact one. But I think import, they import.
yeah. There are a lot of companies that make non-cannabis gummies. They've been around for a long, long time. But it's not. It's actually quite easy to make cannabis gummies at home.
Mm-hmm.
Um, and it's good dietarily speaking. It's not harsh on your body, and they're effective. Other things that people do. There are infused beverages that are effective, and there are other types of edibles, such as honestly, almost anything you can think of that requires a fat
Mm-hmm.
to cook. And I say it requires fat because cannabis oil is not water soluble. So it's good to mix it with a butter or an oil like coconut oil, and then use that as the fat for your for cookies or chocolates or brownies or things like that.
Mm-hmm.
So those are the primary ways. There's also something called vape carts, which is cannabis oil put in a small. And this is the end of a vape cart.
Mm-hmm.
See, there's this liquid here is
Oh,
cannabis oil,
okay.
and there's a mouthpiece at the top
Uh-huh.
that people draw from, and
Uh-huh.
this part gets connected to a battery. So the battery is
Oh.
often long and narrow. It kind of looks like a pan. It's
Uh-huh.
literally a battery that heats a cell
Uh-huh.
up here. It's
Uh-huh.
often made from ceramic or metal.
Uh-huh.
That cell warms this liquid up so that this
Uh-huh.
liquid becomes a gas,
Wow.
and
Uh-huh.
then that's consumed. Now, I'd say that these are good, possibly for treating, for as a means to treat as a means to
Cancer.
treat cannabis. However, um, I'd say it's only good if you know well the manufacturer who makes it,
Mm-hmm.
because this format, it's very easy to put liquid in here. Um, that what a lot of unsavory manufacturers will do is they put a lot of liquid in there
Mm-hmm.
that's cheap, so it reduces. It's not safe. Let's
Yes.
say people put liquids in there that are not safe for human consumption,
Mm-hmm.
and you want to stay away from anything like that, especially when you're trying to treat cancer.
Uh-huh.
I've sat with cancer patients numerous times, and it's imperative to give them healthy food. It's very, very important to make sure, like a diet of fresh fruits and vegetables is very, very good. But it's important to have organic stuff, because pesticide residues can really, really hurt. When someone's taking chemotherapy, uh, and they get a piece of fruit that hasn't been properly cleaned or that is not organic, it just increases that feeling of nausea. And
Uh-huh.
I'll finish that thought up. No, it's important, again, if you're sitting with someone who's having cancer treatments. Uh, what I was saying is that uh, having a large part of your diet being fresh fruits and vegetables is very good, very helpful for so many reasons. But the presence of pesticides on fruits will really increase nausea if someone's going through cancer chemotherapy treatments. But just to resum that up, I do feel the the best means for consuming cannabis to treat cancer, in my opinion, and I am not a doctor, but this is just anecdotally and in terms of working with the patients that I've worked with, and you know, I'd say close to about 200 that I worked with. That's not a lot, but you know, it's more than just a small sample size. Definitely, the capsules are first. Gummies are good. You know, edibles are good as long as they don't have a negative interaction with chemotherapy.
Mhm.
Smoking is okay as long as you're not treating lung cancer.
Uh-huh.
Um, and these vape carts are good as long as it's a reputable manufacturer who's not putting uh, things to extend the liquid that are unhealthy.
Mhm.
And unfortunately, that happens in the case with a lot of these manufacturers. So for the most part, I'm not going to trust this
Mhm.
for cancer treatment because um, the bigger the manufacturers get, the harder it is for them to maintain tight quality control.
Quality. Uh-huh.
Hmm. And um, and quality control is of the utmost importance when you're treating a cancer patient.
Mhm.
It's just imperative. Um, so you know that's those are the primary ways that people or treat cannabis. You know, and I should throw a mention to another extract that is someone actually developed specifically for cancer treatment. It was created by a guy named Rick Simpson,
Mhm.
and he put this together to treat family members for cannabis, and there was a lot of a lot of success. And it's a very rough, raw extract. It's not refined,
Mhm.
and it leaves a lot of the other other material in the plant in the extract instead of filtering everything out except for the THC. It is called RSO or Rick Simpson oil, and it's very very viscous. It's very like at room temperature. It is a liquid, but at say at um, 15 degrees Celsius, it doesn't run. You know, if you turn it
Uh-huh.
upside down in a jar with the lid open, it's going to stay in the jar. You
Mhm.
have to really heat it up to about 25, say 30 degrees in order for it to get viscous enough that you can put something in there and take a little bit out. But often that you buy that from a store in a syringe, and you just put like a rice sized serving on your knuckle and just eat it like that.
Mhm.
That sounds funny when I describe it, but that's just the easiest way to do it because
Mhm.
that stuff is so sticky. It's just
Uh-huh.
impossible. It gets on you. You're scrubbing it off. It takes forever to get off. It's kind of a
Uh-huh.
mess to work with, but it is very, very, very effective.
Effective.
Yeah. You know, again, we're talking cancer, and cancer, you know, aside from cancer and the horrible things it does to your body, I mean, just, you know, it kills. Cancer kills.
Mm.
Um, but, you know, you also have a big problem with the medicine that you take to treat the cancer.
Mm.
And, and that's one thing, you know, I feel like it's important to touch on first. You know, effects of chemotherapy and other medicines are used to treat cancer are like nausea, low appetite, inability to sleep or insomnia, and then you know the ensuing mental health problems when you have all these things.
Mm.
And really and truly, cannabis uh, treats all those items beautifully. Cannabis is great as to stop nausea. That's one of the items that cannabis extracts have been legally in the United States legally sold by pharmaceutical companies in the form of a drug called Dronabinol, or and it's used to treat nausea.
Mhm.
But also, again, Cannabis is great for no appetite. Most types of cannabis will increase your appetite and help you eat. Um, and then insomnia, that extract I mentioned, Rick Simpson oil, is perfect. It's a perfect thing for helping people sleep.
Mm-hmm.
Um, yeah, and then the mental health issue, it just calms you. Consuming cannabis relaxes and calms you. And when you're dealing with the stress and the rigors of going through a cancer treatment and the hell that it injects in your life, um, just being able to eat and sleep well and stop throwing up all the time, that's a huge aspect. If you want your body to really heal,
Mm-hmm.
um, it needs to be fed. It needs to rest,
Mm-hmm.
and that's what the ideal. Let me step back from saying ideal.
Mm-hmm.
Um, but I am just really not that aware of other things that are natural, that aren't synthesized, that don't have numerous other horrible side effects like marijuana. And
Mm-hmm.
another really nice thing about marijuana is that it does not interact with most other drugs that are going to be used to treat cancer.
Mm-hmm.
So, and again, some of these methods I've mentioned of consuming cannabis can, or like I think smoking is probably best for nausea.
Uh-huh.
Sometimes uh, the capsules are very good, and the capsules might be good for settling your stomach. They're also good for nausea. But I guess what I'm trying to get to is that it's a very personal thing,
Mm-hmm.
you know. So, you know, uh, it's great to have these conversations with someone who knows about these things.
Mm-hmm.
Often at marijuana stores, some marijuana stores will have someone on staff maybe 2 days a week so that someone can come in, sit down, and discuss.
Mm-hmm.
It's best to recommend a regimen, take it for 2 weeks to a month, take notes,
Mm-hmm.
see if it helps with sleeping. Does it help with insomnia? Uh, does it help with your appetite? Does it help um, uh, with your mental health?
Mm-hmm.
And if it doesn't, then adjust it a little bit. Maybe put a little bit more CBD in, because the two cannabinoids that we're looking at, the primary cannabinoids with cannabis, are CBD or cannabidiol and THC, which is also known as tetrahydrocannabinol.
Mm-hmm.
Um, those are the two cannabinoids that we're looking at that primarily interact and help with the symptoms of cancer and the symptoms of the drugs that are taken to treat cancer.
Mm-hmm.
Okay. Now, then we can take it. Let's shift a little bit and talk about um, cannabis as a treatment for cancer itself.
Mm-hmm.
Um, and that's where this gets really tricky, you know, and because I've done research, and my research is actually working with patients. My research is the means that a lot of people use today is just looking through the internet,
Mm-hmm.
and the internet can be a trap. Uh, it's aggravating how much disinformation there is,
Mm-hmm.
and even this morning as I was uh, researching or re-examining
Mm-hmm.
some of the things I looked. I typed in the search "cannabis for cancer," and I immediately come across a couple websites that are saying that cannabis is not a viable treatment for cancer at all.
Mm-hmm.
And some of those were United States government websites.
Uh-huh.
And it said, as far as treating cancer itself is concerned, there's no scientific proof that cannabis helps. Okay, and that's the first line I read in one of these websites, and that confused me,
Mm-hmm.
because in my years of working in New Mexico in medicinal cannabis, I seem to recall going through numerous studies conducted, not just, there are very, very few in the US, but, in countries such as Spain, Portugal. I'm trying to think, there really aren't any Asian countries that have
Mm-hmm.
gotten into that. I know that in India, cannabis is frequently used in folk remedies, but they haven't
Mm-hmm.
really gotten into the realm of studying cannabis directly as a treatment on cancer.
Mm-hmm.
But and that's this morning, and it really disheartened me. It really upset me because I'd remembered these other studies. So then, I had a little bit more time before we started this talk. So I started doing some research to find some of these studies.
Mm-hmm.
And I kept it to the US because silly American doctors don't trust any studies except studies done in the United States.
Mm-hmm.
They don't want to consider studies done in Israel. They don't want to consider studies done in Great Britain or Spanish or Portugal, and there are very good studies done in these other countries. So I focused on, I narrowed my search. I said Harvard studies for cannabis treatment,
Mm-hmm.
and boom, because Harvard is a reputable research facility in the
Sure.
United States. If you say, well, Harvard says, people are going to say, okay, I believe you. Harvard says it's got to be true.
Uh-huh.
And so, and it wasn't I didn't have to scroll through pages 4 and 5 of Google. It was right there on the first page of my Google search. And the study that I quoted often when I worked in New Mexico was a study done on lung cancer in Harvard.
Mm-hmm.
And it was great because this was on the first page of the Google search, and they said that in this, actually, let me quote it because I have it right here.
Uh-huh.
It says that treatment of cancer. Uh, Study on cannabis chemical as a treatment for no, that's pancreatic cancer. The active
Uh-huh.
ingredient in marijuana cuts tumor growth in common lung cancer in half and significantly reduces the ability of the cancer to spread.
Mm-hmm.
Again, I'll repeat that. The active ingredient in marijuana cuts tumor growth in common lung cancer in half and significantly reduces the ability of the cancer to spread. And that was at research studies and research done at Harvard University in 2007. So it wasn't, it was about 20 years ago, and there have been other studies since, um, and that's significant.
Mm-hmm.
But depressing, the thing that's depressing is that if you don't do a good search, you'll land on pages that have a lot of disinformation
Mm-hmm.
that directly refute that. You'll have websites and individuals going out there and very loudly saying that cannabis does not help cancer,
Mm-hmm.
uh, and that's disheartening. Let's just say. And then I didn't spend much more time on that, but as there's this other study, and they haven't gone too deep in this one, but they're saying that it may help fight pancreatic cancer,
Mm-hmm.
right? And pancreatic cancer is bad. It's one
Mm.
cancer's with one of the highest mortality rates. Typically people don't recover from pancreatic cancer. And
Uh-huh.
it's a very painful, very brutal way of dying. But again, this is another cannabis Harvard study,
Mhm.
and the things that they're looking at are suggesting that it might be very helpful. Um, so it's hard. It's like, where do you go? Who do you believe when you come across conflicting information like this?
Mhm.
I was in the industry long enough, and so you'll come across a lot of people who have answers. And one of the answers that's very popular is that cannabis is a natural plant, and if people can buy an extract from cannabis that is relatively inexpensive, that is going to be safe in terms of toxicity, meaning um, no, really, no, and we mentioned this previously in our discussions of cannabis.
Mhm.
No one really, the instances of people dying from consuming too much cannabis.
Mhm.
Um, when I was working in the medical area, we hadn't heard, never heard
Mhm.
of anyone dying from consuming too much cannabis. If you consume too much of the extract by inhaling it, it
Mhm.
can make you a little bit sick. It can make you nauseous.
Mhm.
That's about it. People don't die.
Mhm.
And so, I'm sorry because I'm thinking about this, and it brings up so many things in my mind
Mhm.
uh, as I think about it. But the common thread that people use to explain this contradictory information is active disinformation being sown by the companies who stand to benefit from possibly um, from creating a medicine
Mhm.
and and then selling it to the public at a very high price.
Mhm.
But they can't sell it if consumers know that they can just go to a store and get an equivalent thing that will achieve the
Mhm.
same results or a fraction. And I say a fraction, we're talking about maybe a $50 treatment as opposed to, pharmaceutical company, that they'll start charging upwards of thousands, if not tens of thousands of
Mhm.
dollars for the same treatment. So, and I have honestly spoken with employees of pharmaceutical companies who will say that it does concern the pharmaceutical industry, and that they do spend money to create misinformation about the value of cannabis
Uh-huh.
as a treatment not just for cancer, but many, many, many other things.
Mhm.
So, um, I haven't spoken to these cannabis, not cannabis, but pharmaceutical executives.
Mhm.
I have talked to a couple individuals and these weren't like hippie kids walking around smoking weed and saying, "Hey, dude, oh, take it." Oh, you know what? Those stupid pharmaceutical, they're ruining everything for us. I mean, these are actually professional individuals who
Mhm.
work for pharmaceutical companies in different departments. They're not necessarily the scientists who are conducting the
Mhm.
experiments on patients, but there are people who have significant roles in pharmaceutical companies. So uh, there is a lot of conflicting information. I do feel that the possible good that can come from it is enough to warrant looking into it on an individual basis. That's just the way it's going to have to be.
Mhm.
until someone's willing to invest in a facility and willing to pay doctors to talk to patients on a regular basis.
Mhm.
Um, yeah. Is there anything? Yeah, I'm kind of
Uh,
I'm going on and on
okay.
and on.
Sure,
Sorry.
sure.
Um, is there anything that springs to your mind?
Uh, no, Scott, I want to listen to what you had to say, and because you know much more, like about these things. So, did you cover all the things you wanted to?
I just about, there are other things to talk about here that are not necessarily in the realm of treatment, cancer and dealing with cancer. And again, I have, just let me say from personal experience, I've had gosh, I've been very close, I'd say very close to two people that I've known personally who have cancer. One is still alive, one is not alive. One person I went to chemotherapy. I sat with her during her chemotherapy treatments. I'd go to the grocery store afterwards and buy a big bag of um, like very fresh, very organic fruit for them.
Mhm.
That was always helpful. And then this other fellow who's a very, very good friend was diagnosed with liver cancer, and that is very tragic. I mean, almost every death is a tragic thing.
Mm.
But he was very, he was 36 at the time he died. He was diagnosed at the age of 34. He was very intelligent, had a very good job as a software engineer,
Mhm.
but he also had another job in making cannabis extracts. He was diagnosed with liver cancer, and he passed away about just a little over 2 years after diagnosis.
Mhm.
And he I mean, he had access. He had direct access. He because he made these extracts
Mhm.
and he consumed a lot. Oh, and there is one other form of cannabis that I've just remembered that he made and used, and that's cannabis in the form of suppositories.
Mhm.
And I've heard that that's very useful. The tissue down there is very susceptible to THC going into the bloodstream,
Mhm.
and he felt that it was effective. It did help remediate the symptoms of the cancer and the cancer treatments
Mhm.
because he was taking very aggressive medicine. But in the end, yeah, he died.
Mhm.
So, as you know, cannabis with cancer, in some it will help. It will help a lot. Some it will extend the lifestyle. So, at the very least, it will help treat the symptoms of the medicine and the disease to a place where you can interact and talk to people instead of just lying in a bed suffering. But no one should ever say that it is that thing which will cure all cancer. That's not true. Anytime you hear someone making this statement, um, it's just simply not true.
Mhm.
Um, but on an individual personal basis, it's absolutely worth the time to do the research. And if you're not able to because you're sick, a loved one can go and talk to someone at a store, or even just start. Make a pick capsules.
Mhm.
Take them for a couple weeks. See how they work. Do you feel better? Are you able to sleep? Um, and if not, try something else. And again, there's no guarantee. But in readings and in my personal experiences, I've seen a lot more people that it's helped than it's not that have not received help from it.
Oh, okay. So Scott, I remember like one time you said we'll do like 20 minutes of meditation also today. Eh? I think we
Uh-huh.
discussed about like for 40 minutes now. So last time you said
Okay.
uh, that there was a gentleman and he was diagnosed with cancer, and then after
Mhm.
taking cannabis, he felt like he was given new life. No, so I remember.
Yes. Oh, yes. Yeah, Mr. Yeah, I shouldn't identify him by name. That
Yeah, yeah,
violates
yeah.
health privacy laws. Yes, it was a great fellow. He was diagnosed stage 3 lung cancer. He was also he's devoutly religious. He went to Catholic church every Sunday.
Hmm.
Um, we put him on a regimen. He came to us. This is when I worked in New Mexico. He came to us stage 3, but still they said get your affairs in order. They told him he'd have about 3 to 6 months to live,
Hmm.
and um, he had a lot of personal experience with cannabis, but he had, and that's important because if you don't have experience with cannabis and you take it, there's this feeling of being high that is going to be maybe different from anything you've experienced before, and it might be a little dis it might make you feel a little uncomfortable. I didn't have to worry about that with him because he'd smoked a lot of his life. But uh, we started him on a program of CBD and THC combined,
Hmm.
about a 1:1 ratio, but very, very high, a lot. So he's probably consuming about 500 milligrams total cannabinoids a day.
Hmm.
I remember seeing him a year after we started treatment. He felt great. He was ecstatic. He felt he'd been given another 6 months of life.
Hmm.
And he actually asked us to come speak to his church.
Yes. Yeah.
And yeah, and that was sweet and fascinating. I personally wasn't comfortable doing that because a lot of these talks, from my perspective, I have to be very careful. I'm not a doctor,
Mm-hmm.
and I can talk about studies, and I can talk about personal experience with people who I know who consume cannabis and varying rates of success with people I know who
Hmm.
consumed. I cannot say you need to take this and this will fix this or this will make this cancer all better.
Hmm.
I, that there are actually relatively strict laws about that kind of stuff.
Hmm.
So I just wasn't. That being said, I wasn't comfortable going to a church, and I didn't know what I'd say to a church.
Hmm.
Yeah. But I was thrilled to death for him, and I know that he had at least another year. I left that job and I actually moved to another state at about the 18-month mark with his treatment. But at the point when I left, he was still in a great mental place, and he felt that cannabis had given him, at least at that point, another year of life.
Hmm.
And that's important, right?
Yeah, yeah.
Loved ones. If you have a close, tight knit family, he was Hispanic. He had a big, very tight family. He
Hmm.
was the patriarch of that family. Is important to him. And like every moment with children and grandchildren is golden, and especially when you know that you're not going to be able to have those much longer.
Hmm.
So and so there's that possibility. I personally do believe that just being able to eat properly, sleep better,
Hmm.
and not um, throw up stuff all the time. I mean, like being able to remove those three factors from your life does improve life.
Hmm.
It does improve your enjoyment of life, and I think by making it things positive and manageable, I personally believe can extend your life.
Mhm.
I mean, I've known miserable people who've lived forever too,
Mhm.
but um, having a positive, happy, kind of joyous um, life, I feel makes it a better life, and it probably will. How am I trying to say this?
Mhm.
Being able to spend time with your children and your grandchildren is great, and
Mhm.
that's better. And I think you can have a little bit more time with use of cannabis. I do believe that.
So just two short questions only, yeah? And one is like if somebody needs like your help or just like information, they can always contact you, right?
Oh, for sure. Yeah,
Uh-huh.
and yeah, yeah. Please, if someone wants to send me an email or contact me through WhatsApp or anything like that, I'd be happy to talk to them
Mhm.
and try and steer them in the right direction, or just have to sit down one on one.
So we'll
You know,
definitely put your details in the video as well as the post.
yeah.
And is it Scott good like before chemotherapy if somebody tries this? According, I'm not asking you to give like some kind of medical advice or anything, but that is the thing, right? Because those days elders and all could say, "Why don't you try this? Why don't you do this?" No, but now they
Hmm.
have imposed these laws. You cannot even say like, "Why don't you do this?" and see, because it's like
Hmm.
you are so tied up and like tied up. Sorry, and then
Yeah.
there are so many rules and regulations that say like you cannot do that, no, but we are
Right.
doing it like not, we are not trying to trick somebody or scam somebody or anything. We
Hmm.
just like trying to help somebody, but there are like rules that say because of scammers also it can happen, but even a legit person who really wants to do something for another human being is prohibited actually, not restrained, even prohibited because of these kind of rules, right? So, according to the uh, cases you have seen, Scott, over the course of years, and the people like you have associated, uh,
Hmm.
uh, was it beneficial for them from the things you saw to before
Oh yeah.
chemotherapy to use cannabis and C as treatment?
Hmm. And it's one of those things. People and human beings are funny, Sanji. Like meditation is a great thing. It can help with so many different things, but you have to use it. It's like a tool.
Mm-hmm.
Um, you only benefit from it if you actually use it. Not talking about it. Talking about it doesn't. Talking about it's great because it spreads awareness,
Mm-hmm.
but um, you actually have to do it. You have to use it, and then the other tricky thing about human beings is it can benefit them greatly, but then they forget that using that tool or doing that practice is a thing that helps contribute to this improved life.
Mm-hmm.
And cannabis is kind of like that. uh, you know, people are people. That you can start someone on a regimen of cannabis. They'll be taking it for three months. Things are going much better, and then they'll just start thinking about something, or they'll read something that says no. Maybe they'll read one of these misinformation articles that says cannabis does not help, and then they'll stop,
Uh-huh.
and then a week down a month down the road, they're like starting to feel bad again, and
Mm-hmm.
they forget. Hey, stick with your regimen, stick with that thing that helped you get to this better place.
Mm-hmm.
Um, and I don't know if I actually properly answered your question there or your statement, but uh, I do. I'm happy to talk to anyone about this. Within reason. I'm not inclined to wake up at 3 o'clock in the morning and have an in-depth conversation. But
So
and
they
no
can
one
send
really.
a message or email and contact you and ask, no, what is the proper time to discuss?
Yes, absolutely, absolutely.
Ah.
So, Yes, and there was something else I wanted to mention, but it escapes me at the moment. We can start with the meditation because
Sure,
it's
sure.
kind of actually, Sanji, now.
Yeah, no, we do some meditation.
Yes.
So Scott, if you want, you can just stand and like stretch out or anything. Or if you want,
Okay.
drink some water or something. Yeah, be more comfortable
Mhm.
because you've been talking as well as like even seated for a long time. Okay, so please sit comfortably. If you want, you can move your body, even the head, the neck, the shoulders, the elbows, the hands. If you want, you can shake your hands and like loosen up and just see the placement of your knees and even the legs and how the feet are also placed. Yeah, you can use all the cushions you need. Uh, the idea is to be as comfortable as much as possible. Then we try to take it to the next level. Okay, so we can use the breath, the intentional breath. We take breaths into our body from the nostrils and let it go into your body. And with each exhale, try to release and relax. We take a deep breath, and it's like we are squeezing out from a tube any kind of discomfort, which actually happens, or any kind of tension, even mental tensions, because it comes through our physicality. It has nowhere else to go. That's why people sometimes get headaches, or like they throw up, or they sometimes even from the opposite side, even, or sweat, the heartbeat. It what happens in our minds goes through our body. So when we incorporate the breath, it can flush out those kind of things. That's why when people are angry, they breathe more. When they are tense, they breathe more. When they are afraid, they breathe more. Uh, so we are doing it without none of that happening, but we are doing it intentionally. So take a few deep breaths, let it be inside your lungs for some time, and then try to, like as if you are emptying a balloon, let go from the mouth. And you can use a frequency like a count even. You can do like 1, 2, 3, 4, breathing in and keeping it in for like 1, 2, 3, 4, 5 or 6, and then you can exhale up to 8, but do it at your convenience from the mouth. 1, 2, 3, 4, 5, and you let go. So 4, 6, and 8. Then let us take our attention to our body. This is very crucial. It keeps us grounded within the framework of our body. It's not limiting us, but it's very easy to like then fix things. It's like when things are scattered all over the place, say your yard and everywhere, it's difficult to fix all at once. But if you gather them into one place, it's much more easier. Likewise, within this house of our body, we can do so much things, or home of our body. So slowly use your attention to the upper part of the head from the scalp region, and as if you are releasing a clenched fist, if possible, just see whether you can release those muscles. And you can incorporate the exhaust or the exhale. With each exhale, you can just let that part loose. And then slowly move to your forehead region, all those thinking lines and all. With each exhale, let them go or spread out. Then your eyebrows, Just let it drop with the exhale to the opposite side of your body, sides of your body. Then slowly move down. Check on your teeth and the tongue. Loosen up the jaw muscles. And hold one side of your face, then the opposite side of your face, the back of the head. Then slowly moving down to your neck region, the front part of the neck, the back part of the neck. And you can incorporate the breath with that, especially the exhale. Each part, if you can use exhale to release, actually that it helps. Then slowly move to your shoulders. Just let them drop to, or you can drop the hands on either side or right in front of you across your lap and just let them hang. That also with the exhaust or the exhale, you can release and let go, which brings relaxation. Then the chest area, the abdomen, those areas also with each exhale, you can let go. Then the upper back, lower back, using the exhale, letting go and releasing. Then select one of the arms, the upper part of the arm, and then the middle part of the arm from the elbow to the wrist. You can use the breath and then all the way right up to your fingertips. Do the same to the opposite arm also, from the shoulder to the elbow, elbow to the wrist, all the way right up to your fingertips. You can use the exhale to help you. Exhale from the mouth. And then, just like the upper part of the body, do the same to the lower part of the body also. And then select one of the legs, just like the arm, the upper part of the leg. You can always adjust the posture if needed. Then the knee, then the middle part of the leg, releasing with each exhale, and then the lower part of the leg. Feel your presence there. And with each exhale, letting go and releasing. And do the same to the opposite leg, also the upper part, the middle part of the leg, all the way from the ankle right up to the toes, releasing and letting go with each exhale. Now, your whole body, take a deep breath and think of the whole body from head to feet. And with that deep exhale, let it all release. Letting go and letting relaxation happen. Now, slowly bring your attention to your heart region. Let it be there for some time. And here, you don't have to do anything at all. You can just be there and just see how it feels to be in the present moment, leaving the past aside, future aside. Now, let us use some loving kindness meditation, or we can use the five body parts also: head hair, body hair, nails, teeth, skin. Just those five parts. There are more, but these are the most visible parts. So, if you want, you can slowly place your hands in a comfortable position on your kneecaps or any place, settling them across your thighs, along your thighs. But some people prefer to keep it on their lap. Any way you please. Just try out different ways and see. Some people use specific hand postures. They're called mudra. Now focus on those five parts, and we use the word as repulsive to just separate our minds from the five senses, from the sixth sense. Just think of it's not to feel disgusted or anything. Just think of a time that you are working hard, or in the past, sometime, or when it's very hot and you have sweat, maybe touching the head hair or the eyebrow as body hair. You work outside, maybe in the garden, and there's like soil touching the nail or nails of your hands. And then before brushing our teeth and our skin, maybe you can use the area in your on your face before we take shower or wash. There's like kind of sweat, and we just use the word repulsive. But in the ancient languages, they just use a very simple term, and it is not like to show that it is a gross factor. It's just to show the reality of it. And to smooth things up, use loving kindness meditation. Since we know our posture very well, you can take yourself, and this is a must because this is the opposite of anger. So many tensions, many difficulties arise because of the anger in the deepest level or the subtlest level, which comes up or projects upwards. But we are focusing on the subtlest level, the mind and the mind object. So take yourself as the meditation object and think, may I be free from anger or anything that's associated. Could be stress, it could be agitation, anything, frustration, disappointment, anxiety, depression. If there's a specific word you would like to use or you're experiencing, word means like what resonates to what you are going through, please use that. Otherwise, you can put everything under anger. Okay, may I be free from mental pain. May I be free from physical pain. May I live happily and peacefully. And last time we said, select somebody who's still alive and whom you have a lot of inspiration or respect, and select this person in your mind. You genuinely have a lot of respect for this person. Could be anybody from any field, but you know this person is a very good person. knew a lot of respect, and we keep them in a very high place in our mind. And they should be alive also. Usually, males are asked to select a male, and females are asked to select a female. And just think, may this person be free from anger, may this person be free from mental pain, may this person be free from physical pain, may this person live happily and peacefully. That's all. Now go to something like the breath meditation, which is very powerful, very deep. Slowly focus on the area with the nostrils and the upper lip. That small area, because we don't, nobody sees the breath. The natural breath, we don't see it in normal situations. But we can feel it when it touches that area and goes into the nostrils, and when it touches that area and goes out of the body. It can be warm, it can be cool. Sometimes you can feel from one nostril, sometimes the opposite, sometimes both nostrils, sometimes very subtle, sometimes rough. But here we don't try to, we just want to, we don't try to analyze or anything. We just want to let the mind settle down with that. Like a child is on a cradle. Each time the cradle rocks, the child very calmly falls to sleep. We are aware, we are awake, but we let our minds calm down. And if your mind seems to wander, you can use words like in breath, out breath, or breathing in life, breathing out peace, anything that you prefer. Or there is like a counting method. We'll do upgrade in this also today. There's a counting method. These have been used for like thousands of years. So each we keep like a cycle of 8. In breath 1, out breath 1. In breath 2, out breath 2. In breath 3, out breath 3. In breath 4, out breath 4. In breath 5, out breath 5. In breath 6, out breath 6. In breath 7, out breath 7. In breath 8, out breath 8. Then we come back slowly again to in breath 1, out breath 1. And we can't let that cycle happen. So that keeps us intact with the process. But just see, just try out. I'm just telling as means of support. And for me also, this counting method is the one actually that took me to like the next level. So please try, but we do it in a very relaxed way. So we let's practice by ourselves for a little time. Please practice very comfortably. Okay, to finish our meditation time, slowly take your attention to your heart region and just think, may all beings be well, may all beings be happy, may all beings be peaceful, may all beings be well, may all beings be happy, may all beings be peaceful, may all beings be well, may all beings be happy, may all beings be peaceful. So, with those beautiful intentions, and if we can practice these kind of practices one time or two times per day, and it's like if we can increase the practice time, even the benefits would come to you even faster. And you all are open, free to ask any questions about meditation also. And with that all in mind, slowly take your attention to your eyes. They are like the windows of this beautiful home we have. Or this, they say the eyes are the soul, windows of the soul. And you can slowly open the eyes. And they are considered as sometimes like windows, no, or doors that you can let things out even. So you can let not only you see the beauty of the world and everything, or good in the world, you can let in the good also. And not only that, this light and everything you can transmit outwards also. And gently open your eyes. So any questions about meditation or anything, Scott?
Um, no, it's you. I've always appreciated your knowledge base and your awareness of meditation and the techniques you've read about. Um, it's so, and you've taught me some things that are very, very, very effective and wonderful in the practice. It it kind of gets to the point where, and you brought a lot of different aspects of meditating into the picture with us. It's just difficult remembering all of them sometimes, you know.
Uh-huh. Yeah, that's why I'm trying to like use it the same kind of things. I try to add a little bit more, but there are plenty of things he can do. But later it becomes like we know it by heart. Uh, like those
Yeah,
numerical numbers and all used to like memorize. You know, two multiplied by one is two. Two multiplied by two. It was so difficult when you were kids, right?
yeah,
And
no, that makes sense. You know, it's like a multiplication table. Hmm. No, yeah, and again, like I was mentioning earlier, it's sorry, it's um, it's very important because it's like a tool, you know, and if it isn't used regularly, you won't see the benefits of it. So it's just very important to you know incorporate a practice, a regular practice.
Mm.
You know, don't do it like once a week when you kind of remember it, but right before you're out the door. You know, find the time. Uh, do it regularly at that time. If you can get it in twice a day, that's even better. But you know, you absolutely have to get it in at least once a day. I think on a daily basis. You know, for this, and once you do that, you know, I'm not going to say you become invincible, but it improves every aspect of your life.
Mm. And we can use things like meditation practices while using uh, things like cannabis for like treatment or for cancer. We can use like these kind
Sure.
of things to like make the mind calmer or like the release some stress or fears, anxieties, no, these kind of things we
Mhm.
can use for. So we are giving some treatment for the body as well as we are giving some treatment for the uh, mind also. Because surely, like
Yeah.
I saw Scott, like one time there was this young person. and soon as he was analyzed as cancer and positive,
Mhm.
it's just like this. He was just barely like 20, and it's like it dissolved him, and he came
Really?
as a sick person outside from that place, like the office, and
Mhm.
he could not eat, and he's like the symptoms he knew like was starting to show up. He became super skinny. The skin was also like really like in a bad color and all everything, not like his normal color, no, and everything like, and he was so depressed or like that. And so uh luckily what happened was like they did more tests on him,
Mhm.
and then they realized like it's not such a thing, it's just appendicitis,
Oh, wow, really?
really. And this is a true story. And
Mhm.
then it was a person who was born again just by hearing that. This the same person who came like a sick person out of that office came like total in life. So they did the appendix operation, but
Uh-huh.
that was it.
Wow.
So see like how the mind also plays it, and surely like many people get depressed and all. They just give up on life soon as they hear like, oh, you're positive, you have cancer, this kind of thing. But there are so many things before that we can do, no? And definitely before people start pumping toxins into your system, calling it different names. No, we don't want to point fingers, but yeah, we can try all the alternatives and see before we do those kind of things even.
Mhm.
Okay, Scott. So thank you so much. Yeah, it was a great pleasure. You shared all the knowledge, experiences, and all. So we are doing with very good intention. So anybody, even maybe after 5 or 10 years or even more, listens to this, and they will know like there's something like this. There are alternatives. There are options people can take, and there were people who were talking about these things, and in the so, and may it help anybody, because these things are not easy things, and many people are suffering, and it's becoming more and more common now. uh,
Yes.
Back in the day
Mhm.
we rarely used to hear in these countries also of a cancer patient, but now even little children and the wards and everything are getting filled up with these kind of patients, even little children. So it's kind of
Yeah.
very saddening. So if there's something that we can help, even to reduce the pain or even as a cure, that would be wonderful.
It helps, yes. Like, really, every little thing helps, especially in those moments.
Surely.
Every little thing. Yeah,
So I will definitely
absolutely.
put Scott's details. Scott is a great a mentor, a business coach, and he knows a lot of things, so people can approach him on regard of those things. Also, we'll put all his details. And Scott, thank you so much. You have a beautiful day, and we'll meet again. And for everybody also who's watching at any time period or any time of the day, we wish you will have a wonderful day and time. Thank you so much, and hope to see you again.
Thank you.